Welcome to the Ketones and Coffee Podcast with Lawrence Manaig, where we explore the ketogenic lifestyle and how it can improve your physical and mental health. Each week, we bring you valuable insights and advice from experts to help you on your journey to a healthier lifestyle. This episode is brought to you by BasicKetogenicLifestyle.com, where Lawrence coaches individuals with depression to reverse their symptoms and achieve a healthier, happier life using an evidence-based approach. So sit back, relax, and join us as we dive deep into the world of ketones and coffee. Subscribe to the Ketones and Coffee Podcast today and never miss an episode.
I'm so excited for this. We have a very special guest on our podcast today, Denise Potter, a renowned registered dietitian nutritionist with a remarkable 30-year career. Denise's passion and expertise lie in the realm of the ketogenic diet therapy, where she has dedicated herself for the past 15 years. As the founder of her own private practice and consultant to the Charlie Foundation, Denise has worked with clients of all ages, managing a wide range of medical conditions, including epilepsy, cancer, Parkinson's, diabetes, autism, bipolar disorder, and more. Her extensive expertise in the ketogenic therapies has garnered her recognition, training healthcare professionals around the world. Denise, welcome.
Thank you for having me.
Denise, it's special to have you on the show. You know, like I said, you are making a huge difference in the lives of, people, families who need your help. So thank you for, accepting my invitation.
Yeah, it's great. It's such a fun time, honestly, to be working in ketogenic therapies. So
yeah, it's definitely a grassroots movement, but ketogenic therapies for epilepsy has been around for 100 years, and just now we're learning the other applications of the ketogenic therapy, which can be very, very life-changing for some people. So we'll get to that. What you're doing, in ketogenic diet therapy is really groundbreaking work, and because you and your team, professionals with you, are finding new ways to help people. So I'm excited to talk to you. So you've done this for 30 years and 15 years with specializing on a ketogenic diet therapy. You've helped patients get off medications and treat epilepsy and seizure free. And that's where I want to begin with this interview is I want you to share that backstory on your decision to just specialize in the ketogenic diet therapy. What was that story?
Oh my gosh. So I was telling you, it's kind of a fun story. So I started out at a position at University of Michigan Hospital in 2007, and it was a great position, but I saw people with all kinds of conditions, and ketogenic therapy was one part of that job, of that position. And I had an hour of training on ketogenic therapies, and so let's just say I didn't know anything. So the parents came in and they knew more than me, and there really weren't very many children on the diet at that particular time at our hospital. There were, probably less than 10 at that point, although they'd had a bigger program in the past. And so I didn't know a lot, and Dr. Shellhaas is a wonderful neurologist, came in, and she kind of said, let's start developing, a little bit of a team, and let's start doing this. So we started meeting, and I said, well, you need a dietitian to just do keto. This is so involved. We need, we just need a keto dietitian, not someone who's pulled in all these directions like I was. And I'm thinking, and it's not me, let's get this out of my job. That was my full intent. And so I worked with her for a while, and we were building a team, and over the course of, say, a year, we got that position approved. And we got a part-time ketogenic therapy dietitian position only, which had been the desire of the person who was before me. And so we were really excited. And by that time, I've been working with parents, I've been learning, I've been seeing these children have seizure improvement, sometimes seizure freedom. And I said, well, that's my job. Now I want that job. And it was a big decision because I also did like gestational diabetes. That to me, it was the best thing I had done so far as a dietitian, nutritionist, because when someone's pregnant and has diabetes, they'll do what you say. They want to take care of their baby. So I love that. So I had to give that up, had to give up a piece of what I love, but I was seeing these families change with ketogenic therapy. So, and here's my favorite one, I usually kind of tear up, but I've had many parents say, I got my kid back.
Wow.
And it's like, wow, when you go to work and you have a
So
mom tell you,
fulfilling.
or a dad, I got my kid back because of what you did at work
Wow.
today, like as a dietitian, that never happened before. And so
Yeah.
I was sold. So I took that position, and then, and we continued to grow our program and had a great team, up to 3 dietitians. At the same time, and this is over a course of 11 years, at the same time, people started calling my office at the hospital, and they're leaving me messages saying, can you put me on the ketogenic diet? I have cancer. And I'm like, what? So I had no idea. And so I'm Googling, and then, and I see, oh, cancer feeds on glucose, keto lowers glucose. Well, that makes good sense to me. And so I said, well, I'll meet you at McDonald's. I can't see you here within this job because, it wasn't part of the position. I couldn't, right? And so I started private practice consulting and just seeing people here and there on the side. And then it just, over a couple of
Wow.
years, it grew. And I know you interviewed Beth on here. So in conjunction with Beth, Zupek Kenya, the Charlie Foundation, and referral, people are just begging for,
Yeah.
at that time it was more so cancer. There's nobody helping us with cancer. And then it became, wow, migraines. And then now most recently,
Yeah.
mental health, bipolar, schizophrenia. So these people are just coming saying, we need somebody to help us. And I just thought, wow,
Yeah.
I happen to know this. I've been doing it over here. We apply keto in very much the same way for across the different conditions. It's not a whole different diet for epilepsy versus bipolar. It's really not.
Wow.
It's how do we help you get into ketosis, and how do we help you manage the diet? So anyway, so it just grew, and then I left my job at the hospital. It was a great position. It was a really difficult decision. And I have a great job here and I have a great job at home, but I didn't want to. And I knew that they'd be fine without me. They had wonderful people, but over here I could maybe make an impact in some different conditions that were
Wow.
really exciting and new. And epilepsy is going to keep marching on. And I still see people with epilepsy, but it's fun to grow. So anyway, from there, the story just a nice, slow, gradual growth based on
Yeah.
a need. So it's been really fun to go into these other.
Wow. Wow. It's sort of like your shift to this side of health, and it was a no-brainer. If it seems like for you,
Yeah, absolutely, absolutely.
and people are begging for this treatment too. Like, this is 15 years ago.
Yeah. Well, and I'll say probably, man, I have to put a date on it. I don't know, 7, 8, 9 years ago when I started seeing it for other conditions so much. I mean,
Okay.
people were doing it. I was unaware, really, that it was being utilized so much. And early on, I would have said, oh, keto is only for epilepsy and no one else should do it. I didn't really realize the many, many health benefits. But when you see people saying, wow, their seizures are better, and they're brighter, and they're more alert, and their autistic behaviors are less, so all these things were happening. I honestly thought, oh, wow, well, when you have fewer seizures, it would make sense that you're more alert. It would make sense that you're brighter and happier, right? I attributed a lot of these other benefits to the reduction in seizures. And now as we go on, I think, whoa, a lot of these other benefits are far beyond just the seizure reduction, right? Because we're seeing these benefits for people with all different conditions.
Yeah.
So it was, it's
Yeah.
just been a really long training period.
Yeah. It was at a point that you can never turn a blind eye to that. Like, you cannot unsee what you saw, and it's
No.
fulfilling work for you. I guarantee that.
It is, and I wanted to make sure that somewhere in this, interview that I said this, so I'm gonna just throw it in now so I don't forget. Is what's happening right now, and it's really, and I'll quote Julie Fast, who is an author on bipolar, and we've had a lot of discussions. And she's like, this is just for rich people. She feels like in these conditions, because so many people with mental health conditions are unemployed, they're out of work, they're on disability and things because of this. And so to come to someone like me and see someone in private practice is impossible for some people without the right family support and that. And so, sure, I see a few people here and there pro bono or help somebody out or give discounts, but we can only do that to a point. So what we need and what the Bazuki Foundation is doing, or Bazuki Brain Research Fund and Metabolic Mind, what we hope to do over time is this needs to be standard of care. Now we need more research to get to the point where we can, blatantly say that, but the research is ongoing, and I fully believe that within a few years, and I don't know if it's 5 years, 7 years, I hope it's no longer than that, that we'll have enough evidence. We have enough case reports, we have some studies, and things are ongoing. But if we can get to the point where we say, yes, this is a very, medically proven, scientifically proven treatment, and it can become standard of care, because then we can get insurance to cover it. And then we can say, your doctor can offer this because insurance can cover it, and we'll pay the dietitian to see somebody, because that, unfortunately, that payment from top level down from insurance companies is not traditionally very good to have dietitian salaries paid for. Yet they're the ones in these keto programs for epilepsy. We're the ones kind of running the ball with these programs, and so they need to be paid. And we can't start new programs without that. So again, it's we grassroots, we're starting at the bottom, but we're starting with people that can afford it, which is very one-sided. And so just just put that out there, so people that are philanthropists like the Bazukis, that they'll donate money to these foundations, to the research, to help get it going. And then it's going to come down to a lot of money for the politics of it, to get it into the insurance companies, right? But we have to demand it. We have to first have a little more burden of proof, and then which I have no doubt that we'll have, and then we need to demand it.
It's good to know that people are behind the scenes working on this, trying to get this out there, right? You talked about just giving options to patients. I mean, that's still huge for a lot of people, right? I mean, even if you just help one person, that's enough to, generate some buzz around it, right? And they'll certainly tell their friends, right? So this is definitely a win for a lot of people. It's giving a lot of people hope, and we're putting it out there, where you're on the podcast getting interviewed about this. It's just, even if it takes 5, 8, 9 years, it doesn't matter. I know it's gonna happen, because it's changing a lot of people's lives. You've seen it. You've seen it firsthand.
There's just no way it's not going to prove out in research. But that's maybe a bold statement, but I'm not technically a researcher, so.
What's the biggest challenge that you faced trying to push this to patients or clinicians? What's your biggest challenge that you face?
Well, let's see. Biggest challenge. It's two different questions. So with the patients, I'm in a very jaded position. I see people that already have made a decision to at least ask questions to me. They've already, very often now, as opposed to 5 years ago, people come in, they've already been cutting carbs, they've already been making attempts at a ketogenic therapy. So by the time they come, they're, hey, I'm doing this, but I'm not getting good ketones, and so I'm taking them from here to here very often. So that, my job in some ways, that can be very easy. I'm not trying to convince people to do it, right? By the time they get to me, they pretty much know. I mean, they're definitely, I have conversations with people where they want to, help me understand, do I want to do this? And it's pretty easy with the science that we have and the testimonials and the patients I've worked with to be able to say very confidently, I think you should give this a try. There are very few reasons not to try it, very few health conditions where it would be unsafe. So on that hand, again, I'm jaded. As far as telling people in general, I think we have some of the bias, and I sometimes call it Facebook keto, where or just, hey, I'm cutting carbs, which is great. Oh my gosh, we probably eat as a society way too many carbs and way too much sugar. So all these things have really been said for years, but there's really, I think we didn't have a health basis behind it enough. I mean, strong enough to say you will feel this much better if you stop eating sugar and if you cut carbs. So I think it's giving people some of that, but people also, they still hear the doctor saying, and unfortunately even sometimes dietitians saying, well, this is bad for you and it's dangerous. And that's really frustrating. You can eat a fabulous diet on 30, 40, 50 grams of carb, even though it's a lot of fat. I dare say a lot of people eat a lot more vegetables and a lot more good nutrition on a low carb diet than someone who's eating 200 or 300 grams of carb, because they're not eating 200 grams of carb from broccoli. It's basically, it's not where it's coming from, or high nutritional value foods. And so anyway, so all that to say, we're trying to get through some of that bias, and that's a little frustrating. But other thing is with clinicians, and I kind of have twofold comments on that. As far as I have a lot of frustration, honestly, with neurology, because, and that's really broad, so I don't want to be, too broad, but there, and I know when Beth was on, a few weeks ago or a few months ago, she talked about training centers, and she's trained hundreds and hundreds of centers, and I've done a few along with her. And so there are about 100, 110 pediatric keto centers in the U.S. There were 20, maybe they're now 30 to 40 if we're lucky, adult centers, and this is for epilepsy. In the U.S. Imagine how many hospitals there are. There are 9 or 10 states where there's no keto program for a treatment that's been proven for 100 years. So I've had people come to me and say, my neurologist told me not to put my child on keto, and they told me it was bad for them, and they told me this. And then one story, one mom said, well, they told me that, but 2 years ago I did it anyway, and they've been seizure free for a year and a half. So I hear these stories still on a regular basis where a neurologist that and if you've been to school in the last, 50 years, you should know about ketogenic therapy, where they're still telling people no, or because they don't have a program, they don't offer that as an option.
Right.
And I don't know, if your insurance won't pay for a medication, do you just not tell the patient that there is that medication?
Wow.
You say, there's a really good medicine, I don't know, maybe you should try to go get it somewhere, right? Because I think this will heal you, but I can't, get it for you. So do you go to a different doctor? Do you drive a long way? Those things are happening.
Right.
So I have this underlying, tension. Although there are hundreds and hundreds of great neurologists that are offering it. Okay, so I don't want to throw the baby out with the bathwater. So now fast forward to psychiatrists and psychologists who this is just becoming, a treatment where they're just seeing it, and we have the same bias, but they seem like it's catching on, I think, a little quicker. I think this is going to go faster in this area, and a lot because of, again, people like, Metabolic Mind and the pushing through and getting good information out right away, and just, you can't argue with the facts and the things that we're finding. So I guess my biggest thing is the doctors is, why aren't we offering this? Why, and how do we get them? I spoke to one, oh my gosh, I can just keep going. I spoke to someone 2 days ago, and this was a physician, and I needed this, my patient has bipolar, and we have lab tests that we like to do before they start the diet, 3 to 4 months in, and then if they stay on the diet, we're going to test that every so often. And we like to get a carnitine, and it's not a standard lab, and her doctor wouldn't order a carnitine, and then it's July, so she got a new resident, probably a third-year resident, we decided. And I had a nice conversation with him, and I said, well, we'd love you to order this lab. And he said, well, I don't know what to do with that lab. It's not my standard. And I said, well, I know what to do with it. Please put it on me. Please put it on me. And, and I'll take care of it. And he just like, well, that's just not our standard practice. I said, well, but you're taking care of the patient. The patient needs this lab. This is a treatment she's doing. Could you please order it? And he just politely refused. It's out of his scope. And you know what? He's a brand new doctor. I kind of understand. At the same time, he was trained to not do that, and I just really nicely told him, I said, in 5 to 7 years, you'll be ordering carnitine. So, you'll be doing this. And I gave him some information. I hope he looks at it. I hope he considers it.
Yeah.
But you run, it's a wall that we run up
Yeah.
against, and we just run right around it. I've gone from telling patients, ask your doctor if you can do ketogenic therapy, to please tell your doctor you're following a ketogenic therapy. Asking is no longer in my vocabulary. Please just let them know.
The problem with that, when your doctor says something, you tend to really believe in him or her, right? And that might stick to that person. They might not believe anything else but their doctor just because of that title. You know what I mean?
Oh,
They
exactly.
might. Go ahead.
I've had people, unfortunately, with cancer, following ketogenic therapy, doing fairly well, and then go to the doctor, and the doctor say, that's a bad idea,
Yeah.
with no basis for it, with no health concern, no legitimate reason, and then they stop.
Yeah.
And it's tragic.
Some people just, they're not adamant to, looking for other, practitioners. They've had that doctor for a long time, and just so happens that they got diagnosed with, let's say, a lifestyle disease, but then that particular doctor doesn't know about anything about that, about how to reverse that, through root cause applications, right? And they tend to really believe that doctor, and they don't really. What's the percentage of people really, firing their doctor and looking for another one? Like, my parents certainly doesn't do that.
And that is hard. And generationally, I think it gets easier the younger,
Yeah, right,
there's
right.
more generations, because I agree, my mother would never fire her doctor. She is a great doctor, but if she disagreed with him, that would be really difficult. So yeah, I think it's great,
Yeah.
though, that people are becoming more aggressive with their healthcare, and we're able to fine tune it more. But again, the affordability comes into
Right.
play with people. So we're how do we continue?
Is
to
it the
try to-
insurance part of things, that including this in the insurance?
Right, because again, that's my hope, that one day insurance will cover for this, for all of the details that it would take to help someone win with this therapy, because
Right. Because
Yeah,
because then the patients will have to go out of pocket.
right.
Right.
Now,
Okay.
someone to work with us, it's out of pocket. It's out of pocket. Now, if someone, again,
That's
if it's epilepsy, they might be fortunate. It might get covered through the center, or what they do is they kind of hide the dietitians under the doctors, and and the center will absorb the costs because they can justify it. But until a hospital can't just
Yeah.
open a clinic that has no payer base, if there's no benefit, I mean, you can't open a business that doesn't generate any income.
Now I get why you said this is for rich people, because it has to be out of pocket.
Yeah, I mean, there may be some dietitians. I'm sure there are some that will take insurance, but for me, as a small company, and how to navigate all
Yeah.
the insurance, when every single person that comes in has a different company. I mean, can you imagine the
Yeah.
amount of staff I would need to handle that? So
Yeah.
it's a non-option at this point.
Well, what are we up against? Like, with it being underutilized, and and people, hear, even though they heard about the ketogenic diet, which is a great point. You said, if you were trained in the last 50 years, you would have heard about the ketogenic diet. And you talked about how this being a malpractice, they don't give these people an option, right? At least. So what do you think we're up against?
I mean, and it's a classic. It's an honest ignorance. I mean, ignorance can be said in a really mean way.
Yep.
And sometimes it can be, ignorance is, the intent of the word is, you just don't know. And I think there are those that have an ignorance where they just, I've never even heard of that. Before someone told me about, for cancer and these other conditions, I had never heard of it. So I had an ignorance. But I was willing to look and ask some questions and read some articles. And once you start looking, you don't have to go too deep I mean, the science of it even is so simple, and in a lot of ways, that we just,
Right.
that we don't have to go super deep for an understanding. So So, but when the ignorance goes to, and this is difficult because people go to doctors with different things and they'll say, oh, I have this and I eat mushrooms and like they might name off all these different alternative therapies they do, and doctors might hear, 10 of those in one day. How do we get them to say, oh, ketogenic therapy is an alternative therapy that actually works and it's safe and it's a good idea? And I think as this research and the studies come out, that we need to be like national news level. We need to be beyond, obviously, all these podcasts, which are amazing. We need to then be on Good Morning America and Dateline, whatever, night shows are on, these big, we need to be on CNN saying, whoa, this is what's the best thing that's happened in mental health ever. And I think we need that kind of publicity, because that's what's going to get the word out. We've got to get, all the social media and all the, standard media outlets that we can to feature this and then to refeature it. And how do you do that? That I don't know the answer to that. I'm sure that takes money and political pull and a lot of things. But as we find the proof and as people that are well known, it was great because of Matt Bazuki, we're sitting here, right? Or I'm sitting here because we've helped somebody that their family is generous and can afford to take things to the next level. And so the more people, that are high, honestly, again, the more high profile people we help that are able to help keeping it to the next level, I think that's part of it. We need all the science, but turning in, we run on, our society runs on money and who can generate the next, the next thing, how do you get something in front of people? Again, it takes money.
Yeah, again, it's the only way I think that this will be standard practice is if this is offered through insurance and if, get this in front of a lot more people, right? And that, again, takes more studies, and you guys are, absolutely doing a great job with that, with the Bazuki Brain Foundation. And there's a lot more work to do, right? But again, it's already helping a lot of people, and we know it's helping a lot of people. And it's like, again, the science isn't that difficult, right? And you just have to understand how the body works. How how do you feel your body, right? Maybe the problem is people attach, the idea of just a diet. How can I diet? Heal all of these conditions, right? Maybe that's why I like the fact that you guys call it a therapy, but it is a therapy. It's not just a diet, right?
Right, and we're trying to get, the more we can get away from the word diet, it's really hard as a dietitian, that's why we added nutritionist to our name, we rather be associated with nutrition than diet. But the more we get that word out of it, the better, right? And Dr. Brett Scher with Metabolic Mind is, talking about, a therapeutic, therapy. And so, trying to, and we've been saying KMT for a while, ketogenic metabolic therapy, and how do we get people to embrace is always the question. But again, it's one at a time too. It's people saying, I had bipolar disorder and I no longer have any symptoms of that. And what's interesting too is, they would never say remission of certain conditions. Like now you hear people saying diabetes in remission or cured. When I was trained, there was no such thing. You didn't cure diabetes, you have diabetes. Now type 1 diabetes, that's another story, but type 2 diabetes, we would never tell anybody they could cure it or they could be in remission. Never. And now we know we can. And then with epilepsy, they would, they might say, oh, you might grow out of it. But in general, we wouldn't say we could cure epilepsy. Well, with the Charlie Foundation, Charlie was cured of epilepsy, and many other children have been cured. When you get into the adults, I haven't had so many people cured. I've had a lot of people greatly improved. And so now we can say, can we say that people are cured of bipolar? Again, if they're symptom free. I have somebody who's really interesting with schizoaffective disorder right now who's doing, I'll round out the story with her doctor, but she absolutely, after about 3 months, and interestingly, she was going to quit the diet. We got on one call, it's like, I'm tired of this. I don't like it. I don't want to weigh my food. I don't want to, like, whoa, throw away your scale.
Yeah.
Dump the scale, do that. Send me some pictures of what you're eating. We'll look at that. And, we did a pivot, and within the week or two is when she started experiencing benefits. And she went from, and I love this, she went from, literally she said, I heard voices all day long. And her anxiety was 9 or 10, and it's a 2. She was depressed. She had been suicidal. She couldn't focus. She said she's 100 times better. Just every symptom that I can think of. She had tardive dyskinesia, so her face was twitching constantly on her early calls, and absolutely everything was gone. Well, I would say 90% gone. 90% gone. But no more voice, none of that. And so her doctor emails me and says, hey, can we talk? What's going on here?
What's going on?
You might want to interview him. And so we got on a call and just talked, and he said, I've never seen anything like it. This is amazing. And he was willing to say, wow, my patient is doing so much better. What the heck? Right? So that's also what we need, is just one person in a practice, and then that one physician to just say, wow, what happened? Because the meds didn't change. He had lowered meds. She was off half of her medicines and had all these improvements. And so it's a great story. And again, and that doctor, and let's say he's probably mid-40s, he's not an old doctor, not a super young one, but he was willing to say, I want to hear what's going on. And that's that grassroots, because now I guarantee you he's going to be telling other patients about this.
Yes. Yeah. Wow.
I forget the original question. That was just a fun story.
Yeah. Would he say it's reverse? Would he say it's in remission or it's cured? What would they say?
Okay. She's early. She's early on. Let's say, I believe we began in January, and she took a little break from the diet. And people always ask this, can I have a cheat day? Can I, what can I do? And she travels a lot, and she had been doing fabulous when she travels, but she had a trip where it was very difficult, and she got off keto. She got out of ketosis and got home and remained out of ketosis, and she got away with it for a little while, like a week or two, and then boom, all her symptoms started coming back. Everything started coming back, and thank God her family, she has, again, without the family support, without a lot of these, not barriers, guardrails around them, it's difficult. So her family supported her. They got her back on the diet. And after about, hopefully you can hear me because it looks like you're frozen. Okay. And after about 10 days back, we had a conversation, and she's 80% back to where she was. She's not quite there, but she's, and she, terrifying for her because the voices came back, the anxiety came back, and this is going from can't function to I'm looking for a job. And the statistics on people with schizophrenia actually having employment is, I'm pretty sure it's like less than 10% or 15% I've seen. It's very difficult for them with all their symptoms to have a job. And here she was looking for a full-time job.
Here's why I'm gonna say that's a great reminder for her. It's a great reminder for people, right? Same thing with me. I had major depression. I had severe panic attack before, like 6-7 years ago. And when I would go off plan, it's a great reminder to like, man, this is why I'm doing it, and it's sometimes a great reminder that, it's really, it's what we're eating is really making us sick, right? Those things that you can't not have, you think you cannot have,
I don't know,
are the things that are actually making you sick. So, it seems like she's doing well, right? Back on a ketogenic diet.
And and what's interesting, a lot of people come in and they're asking this question, especially with mental health disorders, and they're saying, how long do I have to do this? And I would like to know, right? So the first, my first thought is, after seeing, some people and how well they've done, is, and this is Denise's opinion and experience, right? This is not from a study or anything, but I'm hoping that people, can go, pretty hardcore for a year or two, and as long as they can be hardcore, and then if they need to flex, right, and be more flexible, and maybe they aren't in high ketosis all the time, but I suspect they'll need to maintain a low, and maybe you found this, maybe maintain a low level of ketosis, but I love to get them as high as is reasonable for them to, for whatever period of time they can do that. If it's 3 months, 6 months, a year, let's be tight as long as we can. Try to get as much healing as we can. And then can we do more of a maintenance? What we often are starting in the 20, 30 gram of carb range. What if later they can eat 50 or 60 and be and feel just as well? And that would be great. Again, we don't have, studies to prove that, but some people definitely are seeing more flexibility. And so, that's my hope. But we know we want them to eat a healthy, whole food ketogenic diet. We want them to, again, as much, whole food as we can. We don't want, tons of processed things in there. And they'll find, in general, when they start taking out processed foods, that's always a bonus for people in their mental health anyway, regardless of keto. I think a lot of people feel better when they start removing processed foods.
For your patient with schizoaffective disorder, I think you don't have to convince them, because once they make that connection, right? Once they make that connection of just, if I go back to the way I'm eating, all the symptoms are coming back. So I mean, you can keep them for a year, as long as the second they get better, they'll make that connection. And it's up to them really. But for me, we don't have to convince them anymore, because it's gonna be up to them now, right? If you want to feel better, you've done it. You felt better, right? It's now a matter of decision. Do you want to live that life again, or do you want to live a free life, right? Yeah. So I mean,
yeah. And it's tough though. It's tough getting, and I've had another person who, unfortunately, when he was inpatient and we were doing keto, he was doing really well, and I saw a lot of improvement because he had a lot of voices, and he would talk to the voices, during our call, the whole time he was conversing, with the voices. And then over time, every call it would be less and less. So maybe on a 45-minute call, he only maybe 3 or 4 times interacted, which was a huge difference versus, let's say, 100 or 200 times. And then when he got home and things were much looser and less structured, he had a lot of difficulty. And I was like, oh, and this is also someone with great support, but just couldn't quite maintain. But he got just enough better, he got enough better to get out of the treatment center. So I've seen that too, and that's heartbreaking, because you see someone who saw a glimpse and didn't quite get there, and I still hope he'll come back to it, I hope. And that leads me off to say what we hope to have sometime, and I hope and not too far in the future, are some inpatient ketogenic treatment centers where someone could go, and as opposed to, and I've heard from different people, and Matt Bazzucchi, and people saying, the food they feed you in these centers, and when you're inpatient treatment, it's not good. There are a lot of sodas, there are a lot of desserts, a lot of things
really
trying to, just be people whatever. So there are tons of carbohydrates when people are in here. So we already have a problem, and we're feeding it, making it potentially worse with the diet we give people when we're in treatment. And so if we can have some inpatient treatment, and hopefully we'll have even some like living experience type treatment centers too, where people could come who aren't in a crisis necessarily, but would like to come to learn to cook and, interact and be taught the diet on a much more relaxed basis. Those are some of the dreams we have. And I say we as in Bazzucchi Foundation, Metabolic Mind, Charlie Foundation, some of these that people I'm working with, that I hope, and well, they will happen. It's a matter of how soon they'll happen.
I'm also curious to know about the experience with families now who face situations like that, like that story. How do you, deal with those cases? Like you said, you hope to, have them back on the treatment, but how far can you take that? Or is it up to really the family to encourage those people?
Yeah. So one thing, the way what our model is, and I just copied the model I work with now from what we did in the hospital, because we would tell people, hey, we need you to commit to 3 to 4 months of ketogenic therapy. And this was in epilepsy to say, if it's going to work, we need you to commit. Don't say, and I'll tell people, don't even say you tried keto if you didn't try it for 3 to 4 months. So someone who does this for, honestly, anything less than 12 weeks, I feel like you shouldn't say you did it because you didn't give it enough time. So we model, so preferentially, I like to do a 3-month program with people. And that gives us, and particularly we do 10 calls within that, almost weekly. Sometimes we'll do a shorter, like 2-month program. And then after that, we have monthly monitoring because accountability is a huge part of why things work. Like say, take something like Weight Watchers, which is one of the biggest, most known diet programs. The reason Weight Watchers works for so many people is because they have accountability. You have to check in weekly, whether now it can be online or you have to go get yourself on a scale in front of somebody. There's accountability. So we like to see people at least after they've followed through the program, at least monthly for a few months. And that just keeps you, when you have to get on the phone and you have to look me in the face and tell me how you're doing, and you've also paid for it, that makes a big difference. And you think about it when you do something, right? And so that helps. And within that, we have a health portal, just like everybody does, and they can communicate problems and issues between calls. And then once people are really doing well and they're just very confident, everything's great, labs are good, then we go to quarterly. And so every 3 months they check in. And that's as far out as I like to push it because some people do, twice a year, but so much can happen in 6 months. Like all the wheels fall off by then, and then too many things happen. So I really I have people that have been following for years and years. And that, to me, the accountability is a huge piece of it because you go to your doctor, if he gives you a medication, you have to go back in every 3 months and check in. There's a reason for that. They need to know that you're following the things they told you to do, even if it is just taking a pill, you probably need to look at them and tell them you're taking it or not.
Do you decide who you work with, or do you have a screening process? If you want to know if they really committed.
Absolutely. And sometimes I'll try to talk people out of it. So I do a 20-minute info call with people that I do charge for because honestly, it's just that's my first screening is, are you really serious enough to it's not about the money. It's about, are you serious enough? And so they have to pay $50 for that call because otherwise I'd be talking to people for free all day long. I just can't afford that. So we screen and they fill out a health history form and we look, is this appropriate? 99% of the time it is. But also if someone were to be really inappropriate or I thought they'd be so hard to work with, but honestly, I'm pretty flexible. I like to make things happen. So, if someone's really challenging or I'm really worried about them, I keep them versus giving them to one of my other dietitians. If I'm really concerned, I think, okay, this person's going to be really tough. I'll just keep them. Anyway, so sometimes we might see that, but sometimes when it's parents coming in and they're asking questions and it's their child that they want, of course, as a parent, you want to help your child. They want to help them. They want to get them on keto, and I need to talk to your child as well. And this could be a 20, 30, 40-year-old. I need to talk to them because I don't want your money. I don't want you to spend your time, your money, if they don't want to do this. Because of course, with intent and desperation, I've had people sign up for something where I didn't screen well enough, and it was more the parent that wanted it than the patient. Right. And so, if anything, that's what I try to screen out is willingness to participate because, the whole fact of
and they have to be aware enough.
Drink,
You have to be aware enough of their own problems.
Right. So that would be the biggest barrier. And I also don't let people go to my website and just buy a large package. I want to talk to them before they buy a large package, partly for that reason, because we can't get into that and have someone purchase and then a week later say, oh, I shouldn't have done that. That's all business wise, that's very awkward. And so I just like to have that brief call to screen people and make sure that it's appropriate. And then we get lab work because we want to make sure there are no big issues with their labs. And honestly, very, very rarely do I see lab work that would stop someone from starting a ketogenic therapy. But we screen for that. We don't want them to be in active pancreatitis or kidney failure usually, maybe not, liver failure, carnitine deficiency, some things like that, a primary carnitine deficiency. So we'd like to screen for those things and make sure they're safe before they start therapy.
So having said all of that, right, what makes a difference with, someone who responds to the ketogenic therapy?
So as far as, it doesn't work for everybody, which is one thing. And I tell people this all the time on that initial call. This is not snake oil. It's like anything. For epilepsy, it does not work 100% of the time. It works really well 50 to 70% of the time in epilepsy. And that's with people who have already tried sometimes a plethora of meds. But where was I going? Oh, it's not snake oil. And so who does it work for? We're still trying to figure that out, and no, but because sometimes we do have people that are very compliant and they have really good ketones and they don't have as much benefit as we hope. So we haven't weeded that out yet, but yet it works so often that I have no qualms to say, I want you to try it, regardless. And if we ever do figure, wow, there's this gene or there's this body type or there's, this something that means you're not a good candidate, well then, okay. After 103 years in epilepsy, we haven't found that any one reason not to try it in epilepsy. We will try it for absolutely any type of epilepsy. If they don't have a couple of conditions, childhood conditions, genetic, that we wouldn't do it. But almost any seizure type, we're willing, we'll do keto. And so it'd be a really long time before we say, oh, well, this person with bipolar, they're not appropriate. I don't think we're going to find that out for a really long time. I think you shotgun it, you scatter it, we do it for all these people, and over time, we'll find out if there are really, and I suspect there will be, right? There will be some reasons in different conditions why it isn't as effective. And that is so many years out. Do we want to wait?
Yeah. Yeah, and the ketogenic therapy also does a lot more things, right? It turns off inflammation in the body, right? And let's say it doesn't work for that certain condition, but it's still worth the shot, right? Like you said.
I've had people, and I know Beth said this on your podcast as well, but I've had people where seizures, or they didn't have as much benefit, but their child was so much happier and felt better and brighter that they keep them on the diet. So and that happens sometimes with other conditions as well, where maybe everything doesn't get better. And I've had, interestingly, a couple times, and I'm trying to eke this out, with depression and sometimes bipolar depression, where the depression gets a lot better and we're still fighting with some anxiety. And that's really interesting because usually that's not the case. And so I'm thinking, what's going on with these people? Sometimes it's thyroid. Their thyroid improves so much. If they're on a thyroid medication, it may need to be adjusted. And so that's a really interesting take. But, and a very low TSH could cause a lot of anxiety.
Right. Yeah.
In the body. So some of those things, we're trying to figure that out, but maybe can we just correct that and not have that issue? So again, it's really, there's a lot to learn here. There's a lot to learn.
And let's get back to the point where, how do we get more prescribers here, right? That's the main issue here. Yeah. Giving people options. I'm losing my voice here. If you You were on the same boat actually years ago, right? Where you had to pivot. What makes it difficult to change and pivot to the ketogenic diet for some practitioners?
So the practitioners, I think, again, it's acceptance, it's cultural acceptance within their field. And as we work with that, but as far as how to get more prescribers, so glad you asked. I mean, Beth Zubik-Kaney and I have a training program called Keto Mastery. And so we've taken, hundreds of prescribers of dietitians, clinicians, psychiatrists, people through this training program. There's also another one, Dr. Georgia Eade has a clinical training program as well. And so we need people to go through these programs, get trained. And then even, we don't do enough of this, but mentorship, because Beth has been a mentor to me for 17 years now. And, when I had difficult patients, I'm on the phone to Beth. And then later, Beth's sending people to me. Now people are on the phone to me, right? And it just goes down, down, down. We train people, we mentor, we encourage, and then we have more people, right? And now, I have a team who is very experienced already in ketogenic therapies, and they continue to grow and learn in all of the different areas that we're providing it, and they're all comfortable in all these areas, which is amazing. So that part of it, again, it's the training, it's mentorship, and Dr. Eric Kossoff is great about that, talking about mentorship, because you can't just sit here and know information and not share it and not pass it and not what you're doing, right? You're passing information to so many people. So those that are learning, we've got to continue to just disseminate information and honestly too, and in love and in kindness. And I can get pretty salty,
Yes.
when I'm mad that someone wouldn't prescribe it or didn't agree with it. But so many people do. So I don't want to, I don't want to be negative, but we have to keep just encouraging those and saying, wow, here's some research. Would you take a look at this? Would you take a look at this? And maybe 50% of the people we share information with will look at it. That's great. And then maybe they'll share it, so we just have to keep doing that on the grassroots level, and again, on as high a level as we can get. But yeah, anyway, so training, and because I had no training, that's why I'm so passionate about training. And I say I had no training. After a year or two, I had Beth come in, and Beth trained me as one of those 300 facilities, so, but I struggled along for quite some time before I knew there was a Charlie Foundation, before I knew there was someone who could come and train me. And so, yeah, so it's been fun to be the recipient and then on and then be able to share that with others.
Wow, that's amazing. Well, before I totally lose my voice here, is there anything that we've missed here, Nicole, that we missed here, Denise?
I'm just trying to think, I guess just thinking about all the different conditions, and we've named a lot of them, but, I just want to say some of them out loud, that keto is if someone asks me what's the best thing to use ketogenic diet for, like the one besides, kind of the obvious epilepsy, I beg people with migraines to try keto, because I feel like if I had to say one thing is a slam dunk, I'd say migraines. I see people can start on keto and sometimes, have zero migraines within a week or two. I mean, it's almost like some of the really responsive epilepsies, and it's like a little seizure in the brain, causing a headache. And so, so that's amazing. An area that I really hope is more studied soon and pushed is ALS, is Lou Gehrig's disease. I feel like, why are we not? These people have such a terrible diagnosis and it's neurological. Why are we not doing that? And Alzheimer's, or let's say mild cognitive impairment. Let's help people sooner. And a lot more people are coming in and saying, I have these genes that make me prone to Alzheimer's. My mother has Alzheimer's, my father, so wow, let's be preemptive here. And the obvious that we've talked about with bipolar and schizophrenia, and then of course cancer, because we're slowing down the food, the glucose that we're giving cancer cells. And that's just, that's just a few. Those are kind of the big ones I think of off the top of my head. But it's really, again, it's just exciting to be able to apply this therapy to so many people, so many conditions. And again, not snake oil, not telling everybody in the world to do it for every reason. But these conditions that are being studied and that are showing some promise, I really hope if someone was sitting on the edge, should I try it or not? Do you have 4 months of your life to devote to giving it a real good try? And being safe about it, having a practitioner to walk alongside you, because, and there's one more thing I have to say, because I always tell people that, one worry that a lot of people have is keto flu. And this is, I never heard of keto flu. I've been doing this for about, 10 years. And then people started talking about keto flu. And I thought, well, what is that? And so I Googled it, and realized, oh yeah, that's why we put people in the hospital when we start this diet. When we traditionally with children, that's what we would do, because we initiate the diet really fast and we throw off their electrolytes and we throw off their acid-base balance. And so we can treat them right away in the hospital. But no one really needs to experience that if they would just taper off carbs over a week or two and just do this more gradually and drink lots of fluids. And this doesn't say don't have a practitioner to help you, but so many people are doing this and getting sick. Anyway, just drink lots of fluids, get your electrolytes, and don't take your calories down to nothing either. But just do this as a gradual process, as opposed to I'm keto tomorrow and cutting out. People are eating 200 and 300 grams of carb a day, and then they go down to 10 or 20, and your body just it's not really.
There's a lot more that comes with it.
Yeah. When we do it to people that fast is when they're in what we call status epilepticus, when they are, in critical brain danger, and time is brain is what we say, and we're going to do whatever it takes, we'll manage that. But man, for other people, for most of us, not in a crisis, let's do this gradually so we don't get sick. Okay, that's my public service announcement on keto flu. But if you're trying to get keto flu, the Charlie Foundation has a nice little handout about it to help you treat it and avoid it. So
awesome, Denise. We'll link all of your connections in the description box below. I cannot talk.
Thank you so much.
We'll connect. So where can people find you, Denise?
At advancedketogenictherapies.com.
Okay.
And I'm also a consultant to the Charlie Foundation, so we're linked on there under resources as well.
Awesome. I would have you take over this podcast for a bit. Denise, thank you so much. I appreciate you coming on and sharing your story with us today. You guys are doing such great work with the Charlie Foundation and the Advanced Ketogenic Therapies. So everything is linked down in the description box below, so you guys can check that out. All right, once again, thank you, Denise Potter.
Take care.
Bye-bye.
Subscribe to the Ketones and Coffee podcast today and never miss an episode.